Now, the president is saying that, you know, these aren't cuts. You've been misled. This is an interesting chart that shows, and we've illustrated this a number of times on this show, nothing is being cut here. What we're talking about is slowing the rate of growth in Medicaid, one of the most runaway government programs, probably of any government program. Keep in mind, when this was started around the mid-1960s, it was meant for 4% of our poorest in this country. It now has grown to include 40%, and that number keeps going up. So whether you support or reject this, there's no gutting of the program going on here. It will still grow at a fairly good clip here, but what does that mean when the debate itself is based on perceptions that are just being presented wrong in the media? To Red Alert Politics senior writer Ron Girdusky, we've got the Wall Street Journal's Shelby Holliday, and After the Bell co-host David Asman. So David, that's something we keep forgetting. Cutting is very different the way Washington explains it than the way we all might.
Well, and you got to the heart of it, which is that Medicaid used to be a kind of a welfare for a safety net welfare, not cradle to grave for people who are able-bodied. I mean, what has happened during the Obama administration is they turned it into something that was a safety net for the poor, for people who really couldn't afford desperate health care measures that they needed, to something that includes a lot of people who could probably make it on their own. Cradle-to-grave welfare state.
Yeah, but try changing that, right, Shelby? I mean, that's
politically, it is very tough. And I think that the issue we're seeing with the Senate bill is not just a rift between moderates and conservatives, but it's between senators from states that expanded Medicaid under Obamacare and states that did not.
But can I take issue with one thing?
Once you have Medicaid, it is very hard to take it away from people. And there was a poll that just came out from Kaiser. 3/4 of Americans have a favorable view of Medicaid. So politically, you want to play the long game here. You want to play the long game.
I keep hearing this word moderate. I think it's a liberal position, not a moderate position, to want to increase what Obamacare has done. That is, create this new kind of cradle-to-grave welfare system that Medicaid has become. That's not what we can't afford it in the long term.
I think that the political reality is that this was not feasible this year. I've always said that. I think you should have worked on infrastructure. I think that given that the exchanges, that there's certain exchanges, certain states and certain counties that will not have a single health care plan in them, they should have waited until 2018 and let Sherrod Brown and Joe Manchin and Claire McCaskill campaign in poor parts of their state and say, you don't have health care, but it's not Obamacare's fault, it's the Republicans' fault.
Two points I would make, though.
Bring it to the table.
2 points I would make to your comment about moderates. A lot of the moderates want to phase out Medicaid expansion. They just want to do it over a longer period of time. They're not exactly in favor of expansion.
What this bill does is waits 4 years. To your point, Neil, it's not like this bill is calling for cuts immediately. They're going to wait 4 years and then begin the cuts. These so-called moderates, who I would call liberals, they want to wait even longer than that. They want to wait a political eternity. Do you guys think that the markets,
and we're at session lows, we're just over 200 points down on the Dow, I know technology is a very big factor, but do you think the markets are getting worried about this timetable, how doable it is getting this done, how doable it is getting tax cuts done?
Yeah, absolutely, because I've said it over and over again, coming into being such a president that won the electoral vote, not the popular vote, he needed something to improve his approval number, to improve his favorable numbers. He needed something like infrastructure or maternity leave, something that would have
on this, is anything better than nothing? Is the view that no. So,
well, what they have to solve, and I think Connell just brought this up, they have to figure out what taxes they're going to cut in this bill. If the bill's going to pass,
we have one senator who's against rescinding that 3.8% surtax. It's largely, targeted on people like David.
But the reason it's important...
Pretty much. I've been saving my pennies. Saving the pennies and the dollars will
grow. You good savers over there. Well, no, but that's an important number because you can't get to tax reform if you don't know what's happening with the taxes in the health care bill. It's all related.
By the way,
so it does push the timeline down the road.
And Rand Paul has an interesting idea of splitting the bill. That is, taking some parts on which there is consensus, passing that so at least there's something, and then these other more contentious issues you leave for later.
Yeah, but what is consensus?
The problem is just the framing of it. Listen, parts of this bill were literally borrowed from the Clintons in the 90s about Medicaid, tying Medicaid to inflation. That's a Clinton idea. I don't know why.
And what if Republicans just dropped it, gave up, we're not getting anywhere on this, we're going to proceed to tax cuts? I'm told that's a lot easier said than done.
So I did hear a Republican strategist say, if this bill were going to fail, McConnell would not be wasting time trying to get it revived and trying to get it passed. He would just say,
would he hold a vote,
let it fail, let's get taxes.
And put Republicans out there on the spot, go ahead and vote against
No, he's not like Paul Ryan. He's much smarter.
No, I think it's the opposite. I think McConnell wants people on the record.
I don't think McConnell cares about keeping the Senate majority in 2018. He's got a much tighter group. He also wants to win
but
seats.
A rejected vote would then give him the cover to say, well, I tried. Let's move on.
I tried, and now we have more time to focus on
I don't think he wants to hang his senators out.
Can I
dry.
just pull back from procedure for a second to remind folks how desperate we are? This country really is going into a serious debt crisis right now. And Rob Portman, one of the so-called moderates, I would call him a liberal, wrote in 2014 in the Wall Street Journal, the longer we wait to enact reforms, the more abrupt and painful they will be. He's the guy who now claims we can wait like 6, 7, 8 years.
He's the guy who says you pay for tax cuts, too, so they can't be...
Well, I think it's worth pointing out how much control Republicans have lost on the narrative. They are getting hammered on the messaging.
Because a lot of them are acting like liberals. If they stuck to their guns and just passed the thing that would essentially mean that we would no longer be using Obamacare, which we can't afford, we'd get somewhere.
The political realities have changed. This is not 2011 anymore. Obamacare is much more favorable than it used to be. People have settled into
Would the market compel them to do something? I know, and I keep stressing, as we've been saying throughout this show, that this isn't all healthcare related, this is technology, the other phenomena. But if the market did what it did before the passage of TARP, remember that, and it has a huge tantrum here, would that compel action?
Well, the market has already decided, because we see that organizations like Anthem and others have pulled out. They simply can't afford it.
No, but I'm saying the market is also reflecting the inability, for the time being, and not exclusively, I'm just venturing this, to say the Republicans are looking less and less likely to do it.
If it dropped 4,000 points in a day, you mean? Like if you drop like in the recession?
Well, that was a little different. But I mean, we had a drop of almost 1,000 points at that time when it, ironically, a government rescue program failed. And
I think it would incentivize Trump to really push for a deal, because he cares about the market. Trump does say that this is a measure of his success.
Now, we should stress we're still up appreciably since he was elected, still up appreciably since the beginning of the year and his inauguration. But
and we saw this before the Republican House bill passed.
But how much are they going to risk on this? If they backed away, what would the markets do?
Sit and wait.
I think the markets would tank. I don't think they'd sit and wait, because they would realize that this is now become, we've waited and waited and waited for legislation that Trump could put a stamp on. We haven't got it. If they don't get it now, as Trump has said, he's going to let Obamacare fail, and people will see how miserable they are as a result of that. Then we'll get something through. I don't think the market wants that to happen.
But you can look at it two ways. You either fail on health care, get it over with, move on to taxes. That could be a good thing for investors. Or if you can't get anything done no matter what it is,
what would happen
to
the insurance markets in the meantime, and to the entire healthcare market? They would tumble.
I think this is getting beyond the insurance market. I think this is getting beyond. This is a reflection of the cynicism of some, not all, that their whole agenda could be crumbling.
Right, and I think that a lot of pharmaceutical companies and insurance companies put a lot of money and effort into getting this bill pushed this forward, because that's why their numbers we're doing so well in the market to begin with.
But if you go into a free fall here, you could use their drugs, right? I mean, so it's not a negative in that sense.
I'm not sure. I don't think. I think the political realities would be Democrats would sit there and say, look, Republicans can't govern, and Republicans would say, look how bad Obamacare is, and we would go into 2018.
But ironically, Republicans are getting blamed for the problems with Obamacare
But it would be a blame game of who owns this. That's really what we're going into 2018. Who owns the healthcare situation? Democrats for Obamacare, Republicans for failing to change Obamacare.
All right, so real quickly, do you think Republicans get a deal done, all of this hand-wringing notwithstanding?
Yes.
You do?
Based on what we saw in the House, I wouldn't count it out.
All right.
I think you're going to have to go to Rand Paul's situation and split this bill from because there are parts of it
involved.
Medicaid, by the way, is now insuring more people than Medicare. It has become a monster that has to be tamed.
You think they can get something done?
1 in 5 Americans.
I hope so. Yeah, it's huge. It's huge, and it can't be sustained much longer.
All right, guys, thank you all very, very much.